Patient Portal, Improving Quality of Healthcare, presented by Nicole Martin, Joy McKenzie, Allison Meads, and Patience Nagy. What is a patient portal? A patient portal is a secured, web-based application that patients can use conveniently 24 hours a day to access their electronic health record, various services by their healthcare provider, and obtain clinical care. Patients can access the portal from anywhere with an internet connection using a secured and assigned username and password. What is the history of the patient portal? The patient portal emerged within the last decade as a progeny of the electronic health record. The first generation portals weren't very useful, were barely used, and essentially only provided basic electronic communication between patients and healthcare providers. The newer generation portals offer enhanced health services, clinical care, and access. What are some key features of the patient portal? Patient portals are advantageous for patients and medical staff alike. The highlighted features of a portal for patients are enhanced access, administrative efficiency, and improved quality of care. Providing patients the ability to access their health records and healthcare provider information at any time is a great advantage. Portals additionally allow patients the ability to schedule appointments, pay bills, request refills, acquire visit follow-up information, complete forms ahead of visits, and review lab results. For the medical staff, the portal provides a place for them to interact directly with their patients. All of the patient information is housed in one place that can be easily accessed. It also sends reminder notices to the patients. When patients arrive on time, the practice operates efficiently. Health information can be shared with the entire team to improve efficiency and ensure thorough diagnosis. What business problem in healthcare does the patient portal solution solve? Patient portals can improve organizational performance by decreasing the need for in-person visits. Traditional visits occasionally require a follow-up appointment to receive test results and organize treatment plans with the care provider. Patient portal provides a substitution for some of these visits. Outlets of patient portal provide secure emails in which providers can communicate with patients without the hassle of an in-office visit. Through certain organizations, video consult is available, allowing the patient to speak directly with the care provider without leaving the comfort of their home. This allows access for patients to manage more activities online. The flexibility of patient portal allows for online appointment scheduling, insurance management, and prescription refills. This decreases the hassle of the traditional paper from having to be personally dropped off by the patient or called in by the care provider. The ease of access provides convenience and helps avoid the hassle of consumers having to take off work to receive care. Patient portal reduces the need for paper printouts and postage costs. Lab results are available via patient portal, decreasing the need of printed documents and unneeded in-person visits. Providers often are responsible for enrolling patients, initiating the continuum of direct exchange of information. The portal permits physicians to send follow-up messages, reminders, and other information to keep the patient informed. This reinforcement of messages, enabled by secure email, may enhance some patients' adherence to treatment and medications. This concept aids health promotion and disease prevention. Systematically, patient portal improves the ease of access to documents, transparency of information, patient-physician interaction, connection with members, and operation efficacy. Why does a practice need a patient portal? The access and convenience of patient portal saves time and money. A variety of self-service options that save time include decreasing excessive phone time, opening the lines of communication with staff, expediting information sharing, and sometimes even saving the patient a trip to the doctor's office. A portal can save an average of 4.2 phone calls, typically required to relay lab results to the patient. This streamlined, more direct communication approach not only ensures faster delivery of information, it can also reduce stress the patients experience as they wait for a call. Portals save money by increasing patient satisfaction, motivating patients to manage their health, and ensuring HIPAA complacency. Greater patient satisfaction encourages patient loyalty. Loyal patients provide a continuous stream of revenue for the practice by the continuous use of their services and staying connected with the provider throughout all phases of their health journey. Referrals to family and friends increases healthcare brand recognition. Additionally, through automatic reminders, patients are motivated to manage their medications, care plans, and appointments. Research shows that patients who are more involved in managing their health are likely to be healthier and more satisfied with their care. Finally, a properly secured and confidential portal saves money on costly HIPAA penalties. What are the disadvantages of not investing in patient portal? Without a patient portal, a practice is at a grave disadvantage against their competitors. Already overworked staff will have to spend a significant amount of time manually setting up patient reminders, calling in medication refills, and providing patient test results over the telephone, all while juggling front desk responsibilities and patient care. All of this extra work can result in a loss of revenue for the practice due to transcription and billing errors, additional staffing needs, and increased overhead and operating expenditures. Physicians won't have the convenience of electronically communicating with their patients remotely and will have to physically be in-house to see and advise patients. All of these scenarios can equate to long patient wait times, overbooked appointments, and disgruntled patients due to low quality patient care and mediocre customer service. Unhappy patients cancel appointments or are a no-show, further adding to a loss in revenue. How do external or governmental factors affect patient portal? Medicare and Medicaid electronic health record incentive programs, also known as meaningful use, calls for providing patients the ability to view, download, or transmit their health information. This can be accomplished by implementing a patient portal. While patient portals have been in existence long before the Meaningful Use program, the promise of federal incentive dollars to providers for compliance and the future penalties for non-compliance have accelerated the interest in and adoption of the portals. Meaningful Use requires a threshold for patient enrollment and actual use of the portal by patients. The patient's active engagement is necessary to meet the provider goals. Patient portals are likely to become more common with federal incentives and a more engaged patient population. How do health information technology leaders feel about patient portal and how do they implement it? Many health information technology leaders view patient portal as an important way to support patients as partners. Patients must be an active advocate in their own health. Patient portal allows the patients to do more of that. In order to properly implement patient portal, health information technology leaders must be experts to ensure its function. They should understand portal content, user registration, and login procedures. Health information technology leaders must also be able to troubleshoot, answer patient questions, and have a privacy protocol for when privacy is violated and provide technical support. It is vital that health information technology leaders monitor patient portal to further ensure its accuracy and function. Responding quickly to any reported errors, educating patients on patient portal use, and development on enrollment process can aid in the successful implementation of patient portal. Educating clinic staff on its use and how to promote it to patients is another way leaders can implement patient portal. When technology is involved, patient portal is an application that can exist in multiple ways. The most common use is when it is integrated with the healthcare organization's existing website. However, it can also exist as a standalone website, or it can be added to a provider's existing system. With the continuing development of patient portal, its popularity grows as well. Patient portal is able to do so much more than its first generation rollout. It's a lot more sought out now. Epic, Metafusion, and Aetna Health are all declared the most popular vendors for patient portal. How do we enhance delivery of services through patient portal? Increasing portal registration, expanding portal access, and implementing new features encourages patients to take advantage of the services. Once patients are encouraged and engaged in the portal, they can be sent materials and alerts about their health, both preventative and chronic. To encourage growth, vendors are brought on board to add value to the portal. In delivering services through patient portals, providers and staff will continue to educate patients about patient portal benefits and how to use the portal correctly. How will patient portal be promoted? The portal is promoted by providing patients with the services they need and want. The portal must be integrated into the workflow to show value at every step. Patients who will benefit most should be identified for extra attention. For example, diabetes patients that are involved in active monitoring. The portal can be advertised to patients by handouts and mailing flyers, posting materials in clinics, and providing talking points for front office staff. Physician testimonials. Athea Turner of Desert Ridge Family Physicians in Phoenix says that a 10-doctor practice acquired a portal in 2010 to improve its efficiency and increase patient access. Before the portal arrived, answering patient phone calls took up a lot of time for receptionists, medical assistants, and physicians. The portal has enabled physicians to respond to online messages whenever it's convenient for them, with each message taking 1 to 5 minutes to answer. Other staff members handle online communications that don't require a doctor's input, and patients can book their own appointments during certain blocks of time. David Boyles, who leads a 12-provider family practice in Clarksville, Tennessee, purchased a portal early in 2014, partly to prepare for meaningful use. David states, being able to communicate with patients like that has been beneficial and will be even more so in the future.